Welcome back to the Dr. Cliff Show. In today's episode, we are joined in studio by Barbara Kelley, the Executive Director of the Hearing Loss Association of America. Coming up. Episode of the Dr. Cliff Show. I'm Cliff Olson, Doctor of Audiology and founder of Applied Hearing Solutions in Phoenix, Arizona, and I am joined here today with my co-host.
Hello, everyone. My name is Dr. Rachel Cook. I'm also an audiologist at Applied Hearing Solutions, and I'm so excited for today's episode. We are joined in person by Barbara Kelley. She's the Executive Director of the Hearing Loss Association of America, and throughout this episode, we might use the abbreviation HLAA, but what that stands for is Hearing Loss Association of America. And in this episode, we're shifting our focus from hearing aids to the actual individuals with hearing loss, and we're going to chat current legislation such as Medicare access and, of course, the over-the-counter hearing aid bill, as well as best practices, too. So we're so happy. But before we get into all of that fun stuff,
all right, so we've got to talk about our sponsor here. Now, fun story, not fun for the person that it happened to, but we just had a patient not too long ago who was wearing his hearing aids, filled up his gas tank at the gas station, and it isn't a concern about how expensive gas is. This was a concern of he took his mask off, and one of his hearing aids went flying out of his ears at the gas station, and he ended up getting back into his car, and he drove 100 miles before he realized that he actually lost one of his hearing aids. And so this created a situation where he had to call our clinic and say, hey, I need you guys to use my loss and damage claim on my right hearing aid. So he paid his loss and damage claim deductible, got him a brand new hearing aid, so problem solved, right? Well, not so much, because the problem that he has now is that if he ever loses that hearing aid again or he damages it beyond repair, he has to buy an entirely new hearing aid. And so this is where ESCO comes in. So ESCO specializes in providing loss and damage and repair insurance coverage for your hearing aids, so you don't have to pay for expensive hearing aids or expensive repairs before you are ready to. Now, they have a variety of different coverage plans that you can get a quote for your exact hearing aids on their website. So make sure that you go to esco.com/Dr. Cliff, and Dr. Cliff Show viewers will get a $10 Visa gift card just for registering your hearing aids so they can notify you when your warranty is about to expire.
Awesome. Thank you so much, ESCO. All right, well, let's jump straight on in. I'm going to do a quick bio because I don't want to take up too much time here, but Barbara Kelley, she is the Executive Director of the Hearing Loss Association of America, which is the leading organization that's representing the growing number of Americans with hearing loss. She's been part of this organization for decades as it has influenced public policy and legislation such as the Americans with Disabilities Act and the Over-the-Counter Hearing Aid Act of 2017. Barbara's also a very active voice on various boards and coalitions, including the National Institute on Deafness and Other Communication Disorders, and the Advisory Council of the National Institutes of Health, and many others. Under Barbara Kelley's direction, HLAA continues to lead advocacy efforts for accessible and affordable hearing healthcare, providing life-changing education and support for millions with hearing loss, and encouraging all Americans to prioritize hearing health. So thank you so much for joining us, Barbara. We're so excited to have you here.
It is my pleasure, Dr. Cook and Dr. Olson. Thank you. It's an honor to be here in Phoenix. It's beautiful here.
I know, you came in the right time of year, because if we would have asked you to do this like 8 weeks ago, you probably would have said, no way, Jose.
No, thank you, right? So I would love if you could just jump straight on into kind of why HLAA was established in the first place.
Oh, sure, I'd be happy to. People who typically associate with HLAA are people who want to stay in the hearing world with technology. And we were founded, I have to tell this story because it still intrigues me. We were founded by Rocky Stone. That's a name, right? Rocky Stone was a CIA agent. And when I say that, I mean an operative, like James Bond operative. He didn't look like James Bond, but he wore a big body hearing aid. And he coined the phrase between two worlds, not totally deaf, but not completely hearing. So during the CIA, he was chief of station in Rome, and he read lips in not only English, but Farsi and Italian, And he was, an operative. He was responsible for putting the Shah back on the throne in 1959. And a lot of Tom Clancy's books, his characters are modeled after our founder, Rocky Stone. Well, Rocky retired from the CIA at an early age, which you usually do, about 50, and he wanted to volunteer for an organization with people with hearing loss, and he went looking. And all he really found in the literature, in the community, were organizations for people who are deaf and culturally deaf, who use sign language. But he said there has to be more people like me in the middle, who use technology. So he started the organization, and Washington Post reporter David Ignatius, who's still a journalist for the Post now, was writing for the Wall Street Journal. And he asked Rocky, this was in 1979, if he could do a story on Rocky's illustrative spy career. And it was going to be on the front page of the Wall Street Journal, above the fold. And Rocky said, on one condition, that you mention this new organization I'm starting. So the article was fantastic. It was intriguing. It was it had spies, it had guns, it had everything a James Bond story. And at the very end of the story, on the second page, there was one sentence about this organization for people who were hard of hearing. And people reacted. Rocky got hundreds of people saying, hey, me too, that's me. I thought I was the only one who had a hearing loss, and that's how the organization started. And Rocky always said, we're people first who happen to have a hearing loss. And it just started from there. And I have to give credit where credit is due. When the Americans with Disabilities Act was passed, and I was lucky enough to be on the staff when these major pieces of legislation came about, Rocky was on the Access Board. And that's the board that wrote the rules for communication access in public places. And if it weren't for Rocky at the time, there would only be provisions for manual communication, not technology. And so we have him to thank now that technology is part of the communication access rules that we all enjoy today.
I have to assume that when he was a CIA operative that he was using technology to some degree. Even back in the, I'm guessing, 60s and 70s is when he was an operative.
Well, he was. He wore a big body aid, and believe me, this was a problem. If he was with a Russian spy, they thought it was a recording device.
Right, yeah.
And it had been pulled from him. He had been threatened. And there is a wonderful story. The director of the CIA at the time was Richard Helms. And Richard Helms, Rocky was in, probably planning a big coup, I don't know. But Richard Helms was pacing back and forth, and Rocky had to read your lips and use the assistive technology. And he couldn't get Richard Helms' attention. Rocky crawled up on his desk, sat there, probably used some choice words and said, hey, look, I have to look at your lips, and you're going to have to stop pacing. Rocky was very assertive about asking for what he needed, but he realized that most people aren't. And that's what the organization was founded on how to get all the information you can about hearing loss, help yourself, be your own best advocate, and then turn around and help others. And that self-help philosophy is really seen at our local chapters across the country. And that's where our mission of information, education, and support and advocacy is fully alive. It's in our chapters.
Yeah, let's talk more about these chapters. So it's obviously a national organization.
It is.
But you're referencing these local chapters. And so when you say local, how local are we talking?
Well, we have one right here in the Phoenix area, and they're in communities across the country. And they have meetings, they put on educational programs. They'll do outreach in the community, and they also, it's that peer-to-peer support, where you can go to a meeting and you can say, hey, I use this piece of assistive listening equipment. Does it work for you? It works for me. Mm-hmm. And, back in the old days, we're getting really sophisticated with technology now, but back in the old days, there was a lot of do-it-yourselfer Rube Goldberg type guys in these chapters who would wire directional microphones, and everybody would be sticking a microphone in your mouth. And that's where a lot of people really felt that support, and felt that there were things they could use beyond the hearing aid to help them hear.
For sure. I know I've given talks out here in the greater Phoenix area at a local HLAA chapter. And the thing that I love about it is that they are so tech savvy at these chapters. They always meet in places that have a hearing loop installed so they can access through their telecoil. They have remote microphones that they're using regularly in there as well. And so it's always fun to see, a group of individuals, because when you start thinking about a lot of individuals who have hearing loss, sometimes they get intimidated by some of the pieces of technology that are out there. And maybe it's because they don't know of it. And then maybe it's because that they just have not seen a good example of someone using it successfully. And I think that that's the great thing about, having a community that kind of gets together and shows like, hey, here's how we use things like this. This is why the next time you go into your hearing care professional, you should be asking about telecoils and assistive listening devices. So that's the thing that I love about the HLAA out here in the greater Phoenix area. And if you live in a major city, in fact, there's probably a lot of chapters that are in smaller communities across the country as well, but you should be going to, what is it, HLAA.org?
Hearingloss.org. Yeah,
hearingloss.org. Hearingloss.org. So hearingloss.org, and you can look up a local chapter in your area. Fantastic.
And I'm so glad you brought that up about the technology. I'll remember one of the early conventions that I went to, because we have an annual convention every year, and this very excited man came up to me in the exhibit hall where we try to showcase technology, and he said, Barbara, I would wear antenna coming out of my ears if it would help me hear better. And that's the attitude of embracing technology.
Absolutely. Absolutely. Well, that's fantastic. It's fun to hear a spy started the organization.
Right,
That's
right.
crazy.
Like, what an
That's crazy.
unlikely beginning there.
Hey, Dr. Cliff, you should have worked for a spy. That was even more interesting.
No, seriously,
Seriously.
seriously. Man, that's great. So, well, thank you for sharing that. We do have to jump to our next sponsor.
We can do that. Our next sponsor we've got up is Eosera. So Eosera's got a comprehensive lineup of ear care products for ear wax, ear pain, ear itch. Today I want to talk about their Ear Itch MD product. So one complaint that we run into in the office pretty frequently is this idea of itchy ears, right? So if you're a new hearing aid user, that's definitely to be expected, at least in the first few days of using your hearing aids. But sometimes ears just itch, especially if you have allergies, hearing aids or no hearing aids. So Ear Itch MD has aloe and lidocaine in it to help relieve itchy ear canals. Ear Itch MD, as well as all of Eosera's entire line of ear care products like Ear Wax MD and Ear Pain MD, are available at CVS, Walmart, Walgreens, and at most other national retailers. So if you would like to visit eosera.com and use the promo code CLIFF20, you'll get 20% off your entire purchase of any of their products.
Awesome. Well, thank you, Eosera. So let's get into one of the hot topics that's out there right now. Of course, we couldn't have you on without discussing over-the-counter hearing aids. Now, you've probably done 100 interviews with different media outlets on OTC hearing aids, so you're very well versed in pros and potential cons of this. But let's get into it right off the bat. So what do you think are some of the major benefits of having this legislation for OTC hearing aids?
Well, I see it as another pathway to care. There's the traditional pathway that people have used for many years, but the important thing to remember is, as you know, this is for adults only with mild to moderate self-perceived hearing loss. So somebody, I think the benefit of it is that somebody who might not take that step to see an audiologist, or somebody who isn't quite ready to wear hearing aids 7 days a week, every day, but might need some situational hearing. Maybe they're having problems at work or in the restaurants or with their family, might be willing, because the products are in the mainstream and they'll be affordable and accessible. You know, hearing health is so important, and if we get people to take that first step sooner rather than later, that's a good thing. And as you know better than I do, hearing loss is often progressive, and they will end up probably in the good care of an audiologist using a more sophisticated technology.
I mean, it would be nice to have a stepping stone, right? When you start looking at the progression of hearing loss, individuals do typically start. I mean, it's almost, you don't have to start with a mild to moderate hearing loss, but most people gradually progress through that mild to moderate range. And so having something that you can use before you feel like you're ready or just to get your feet wet with amplification is likely a good idea. One of the aspects of it is that this increase of affordability and accessibility. So from an affordability standpoint, obviously, if you go direct to consumer and you don't have to go to a hearing care professional, there's no like service related costs associated with that. And in terms of accessibility, I mean, if you live rurally and you don't even have access to care, or you have issues getting in to see a hearing care professional, and then of course affordability does go hand in hand to some degree with accessibility. There's potential limitations from that standpoint. The thing that I feel like is potentially being overestimated is the amount of individuals who are actually going to jump into the OTC world right off the bat. We do have a graphic that shows prescriptive level treatment rates based on country across the world, and so some of the higher adopting countries. And if we look at the screen there, we see that the United States, at the time of this particular survey, which must have been pre-2018, so this is 2015, is at about 30.2%. Now that number has gone up since 2018. I think it was around 34%. But you look at these other countries, and a number of them actually have free prescriptive level hearing aids for their residents, and you can see that their adoption rates are about 12% higher than the United States. So, Barbara, do you think that we're going to start seeing a significant increase in hearing aid adoption with OTC hearing aids that still are going to cost people money?
You know, I don't know. I think I'm really excited to see what the market bears, but and what consumer uptake will be. I think that's where we need to do a lot of education about who these devices are for and how they might help. And I have been doing a lot of media interviews, and that's one of the questions of the reporters. They're confused, and I think people are confused as to what this market is about and how they might get into it, and is it for them. So I'm hoping, I have big hopes for over-the-counter. My hope is that mainstream electronic devices that will help with hearing loss will be readily available, that might help reduce some of the stigma. We know that every day in the United States, 10,000 people turn 65, and we know baby boomers want to be fit, they want to be active, they want to be healthy, and part of overall wellness is hearing health. So what better way to stay fit and healthy is to take care of your hearing. And I've been encouraged because, if nothing else, OTC has catapulted hearing health as a main issue. Have we ever talked so much about hearing health in all my years? And I think that's a good thing if we can just start not only getting people to treat their hearing loss, but hearing protection as well. That needs to be brought to the mainstream. So what will the uptake be from people? I think we're going to have to see how the market plays out.
Right.
And that's not going to happen on Monday when these things come out, right?
I don't know. I think we'll see a spike on Monday because I think that there's a pent-up demand for it to some degree. Now, we have had DTC, so direct-to-consumer hearing aids or hearing aid-like devices on the market for a while, and a lot of them are just going to be repackaged as OTC devices at the very onset. But I know that there are some companies that are gearing up to have a new product released this coming Monday, October 17th. So we'll wait to see what that looks like.
Right, absolutely. Now, do you think that does HLAA see potential drawbacks to this legislation at all?
Well, are there drawbacks to over-the-counter devices? Well, I think, will somebody get under-amplified or over-amplified? Maybe. But I think that the benefits outweigh the risks. Will people try something and it might not work? That could happen. We know that right now people get hearing aids and they give up, and maybe they don't wear them because they really need a good audiologist who's going to give good patient-centered care and help them through that process. And not everybody has that or has access to that. So, I'm going to stay positive about it. And I just see it as another pathway to hearing health care and another consumer choice. And we know that people like to take control of their healthcare situations. And I also hope that it helps educate primary care providers who all the time, we hear stories about older people over 50 who go to their doctor and they say, you know, I think I'm having trouble hearing. And the doctor says, oh, don't do anything about it, wait till it gets worse. Or don't worry about it, it's part of aging. Well, we know that's really bad advice, but I think maybe if physicians know that there's another avenue out there, they can at least talk about an over-the-counter, start talking about hearing screening. So I think overall, it's a good thing.
You know, I think, I don't want to speak for all audiologists, but I think a lot of us echo the same sentiment of that a lot of us like the OTC route. We like that individuals would treat their hearing loss sooner rather than later. I think the number one thing that we're worried about is that someone would try it and that they just, oh, see, it didn't work for me, so no hearing treatment will work for me. And so I'm interested to see if HLAA is going to, you know, help individuals understand that that is not the end game for them.
I think we can do that. We have some materials now on our website to help people, but we were talking last week that our resources are going to have to evolve as this market evolves.
Yeah.
And I think that's a really important point, is that don't give up. You know, just because an OTC hasn't helped you, you probably do need an evaluation and get the right product, because you know, we know that hearing aids take time to adjust, and that's one of the things that we asked the FDA would be to mandate a return policy. Well, they said they couldn't. They're leaving it up to the manufacturers or the states. But if there is a return policy, it must be noted on the box.
Okay.
If there isn't a return policy, then nothing will be on the box. But that's important that people have a chance to try it, as you give your patients a trial period. Because, you know, it takes a while to get used to something, and if it doesn't work, they should be able to get their money back.
Absolutely, absolutely. You know, we actually have some graphics that we can put up here for Hearing Loss Association of America has a tip sheet here at Over-the-Counter Hearing Aid Shopping Checklist. So you guys can check that out on their website there, hearingloss.org as well. Be a good idea to print that off and take it with you potentially even too if you're going to go into a store to pick up a pair of OTC hearing aids. And then there you have a consideration of OTC hearing aids, a tip sheet that you can use that can provide you with some valuable insight before you decide to purchase a particular product. So those are really nice resources.
Oh, I loved on the shopping checklist at the very bottom, it says you might, you know, does this product require a smartphone app or a computer to program this, and are you comfortable doing that? I love that line right there, because I think that that's something that a lot of individuals aren't necessarily aware of, is that many of these products are going to require the use of a mobile phone based app or computer app or program to kind of fine-tune these devices. So I love that that's on the checklist. So I appreciate that.
Well, thank you. And we know that seniors might not have a smartphone, or they might not be comfortable fiddling with an app.
Right.
So that's really important.
Totally important.
Thank you for highlighting those resources. This gives you an idea of how much people are interested. We have had more hits for those resources, I think, in the history of all our resources page, like 17,000 a day.
Nice.
People want to know. So we want to help people, and we want to give clarity to the issue, because I think there is some misinformation out there, and there's just confusion.
Absolutely. And that's what we need to fight through the most, and that's why I'm such a loud individual out here, because I want to make sure people, just like HLAA does, like help people be empowered with information, and then they can make decisions that make sense for themselves as well. All right, so before we continue, I'm going to jump into our next sponsor here. So our next sponsor is Resound. So background noise continues to be the #1 issue for individuals with hearing loss and who are treating their hearing loss with hearing aids. So Resound designed the Resound Omnia hearing aid specifically to combat this particular issue. This particular hearing aid has been shown to be 150% better than their previous technology in background noise situations. There you have the devices right there. The rechargeable case just shut on me. So these devices do come in rechargeable or disposable, which I love, because not everybody wants a rechargeable hearing aid, but you get the option of having a disposable battery as well. well, and you get Bluetooth connectivity. So those smartphones that we were talking about of being able to adjust your own devices to some degree, you can also do that with the Resound Omnia hearing aids. Now, if you want more information about the Resound Omnia, of course, you can go and check out resound.com. But there's this guy on YouTube that I know that also does a lot of product reviews for hearing aids. His name is Dr. Cliff. You can go check out his review on his YouTube channel as well. So thank you, Resound. And let's jump right into the discussion of Medicare. So if we go rewind time a little bit here, I think it was towards the beginning of this year, beginning of 2022, or maybe end of 2021, there was discussion of potentially having hearing aids, prescription level hearing aids, or who knows at this point, being covered inside of the Medicare coverage, right? Mm-hmm. So let's talk about that a little bit more. What was HLAA's, involvement, or like pro, against, or whatever?
Well, for years we have advocated for accessible and affordable hearing health care. And as we know, Medicare does not cover hearing aids. Some Medicare Advantage plans do, but that's a supplement that people pay for. And the number one call, email, letter, I've been with HLAA for 34 years, is I'm a senior, I can't afford a hearing aid, and Medicare doesn't cover it. So we fought for that. Last year, we came so close to having insurance coverage under Medicare for hearing aids, so much that we were excited. We were talking about it. It was in the Build Back Better Act, and it started out as vision, dental, and hearing, and vision and dental got stripped. And if we go back a year before that, it was in a bill that passed the House. And the problem with it was only going to cover people with severe to profound hearing loss. Well, we knew that, we know profound hearing loss and severe to profound can be covered by cochlear implants if people choose. So let's say you have the OTC market opening up. What about those people right in the middle with moderate to severe, where speech is having a hard time being understood? They were totally left out. Yeah. People at the top end, the severe to profound, people at mild to moderate. So I have to say that we were successful in getting the language in there. We met with all the key committees. We, went through the halls of Congress virtually because it was during COVID, but we were able to get the terminology that Medicare would cover moderate to severe to profound. We really felt there was a victory coming. But it was part of the Build Back Better Act, and we know what happened with that. That failed. So when the Build Back Better Act came back as the Inflation Reduction Act, hearing aid coverage of Medicare was totally stripped out. Very, very disappointing, but we won't give up. We will figure out the next strategy, and we'll work on it.
Definitely. I feel like, unfortunately, a lot of the OTC hearing aid stuff right now took a lot of the momentum away from the Medicare discussion, but it's still an extremely important discussion to have, and I totally appreciate what you said with that middle zone, right? Now we've got OTC on one side for mild to moderate, we've got cochlear implantation coverage or potential hearing aid coverage for severe to profound. We have probably the biggest majority of folks are going to fall in that middle range zone and get left out with that. So such a good victory, and then,
we could really taste victory. We really could. And I said, in my lifetime, this is going to happen, right? But so many people worked on it. And, Medicare, maybe some of your listeners don't know, but it literally takes an act of Congress to get hearing aid coverage in Medicare, because when the Medicare bill was passed in 1965, I want to be very careful about my stats, Dr. Cliff.
I'm going to get you on it. No.
You're going to get me on it because you're a stickler. Medicare was meant to be a social welfare bill for catastrophic health conditions, and we know what it's evolved to. It's really the country's main medical coverage for seniors. So they specifically left hearing aids out. Now, why? In the 1960s, I'm just going to guess, they probably thought, oh, that's something old people get, and it's part of aging, and it doesn't matter. They didn't realize how important it was to treat hearing health. And I think the longevity back then, probably wasn't as long. And we know that people are living much longer, and in order to stay active, you need to take care of your hearing health. So unfortunately, the legislation was built that way, and we have to knock it down or rebuild it.
Yeah, you know, I'm a big fan of accessibility and affordability, as you know. My concern with Medicare potentially covering hearing aids, and we do have Medicare Advantage plans in there, which is a whole nother story, but my concern is that my clinic, we actually withdrew from a lot, we're still participating in Medicare, but we withdrew from a lot of insurance plans because they were starting to dictate the quality of care that we could provide to our patients. And so this is my concern with any insurance involvement. Now, there are some great insurance plans out there. I know Blue Cross Blue Shield, they have their federal employee program, right, where you get a $2,500 benefit, and then you can go procure devices from whoever you want to, and that's the benefit that you get. So I think that there's some insurance companies that do it right, but I'm starting to look at a lot of these Medicare Advantage plans that are out there that are getting individuals to purchase these Medicare Advantage plans in lieu of going traditional Medicare route. And they ultimately are super excited they're going to get hearing aid benefit, but then they find out that they can only go to certain people and that they can only get certain devices and only a certain amount of care. So where does HLAA stand on how Medicare Advantage is completely taken over the insurance game?
And by next year, 50% of people are going to be on Medicare Advantage plans. You know, I think this is health care in general, where the insurance companies are playing doctor all around. Mm-hmm. They're dictating what medicines you can have, what treatments you can have. And we were advocating in Medicare that the patient would maybe get a basic option or a basic hearing aid, and then have the option to top up. If they wanted one with the bells and the whistles and the artificial intelligence, then they could top up. But we didn't get to that point. But I hear what you're saying with the insurance companies are really playing doctors.
Yeah, and it's, I mean, honestly, because I come from the perspective of quality of care is pretty much the main thing that I care about, and anything that takes away from individuals receiving a high quality of care. You talked about it yourself, patient-centered care. Patient-centered care requires one very valuable thing: time, right? And so if you are being dictated time-wise with the amount of time you can spend with the patient because reimbursement only will cover a certain amount and you can't keep your doors open otherwise, what's the option? Well, you either drop being in that network or you reduce the amount of time and the quality of care that you provide someone. So I think that this is a really big concern moving forward. I think insurance can work inside of the world of treating hearing loss with hearing aids. I just don't think that we're there yet.
Yeah, it's going to need some refinement, probably. But sounds like we still have more time, so to work on that.
Yeah, I mean, as much time as it takes, right?
Yeah.
It will. That's what we do. Advocacy is a big part of our mission,
Yes.
and that's what we do.
It has
Awesome.
always been, too, because I
Yeah.
know
Sure.
in my in all of my schooling and in all of my programs, I've known about HLAA since I was, probably nearly 10 years ago. It was like the first time I heard about it. Then in my undergrad program, been to several Walk for Hearing events, so Hearing Loss Association of America has done a great job at advocacy for sure.
Now, those of you watching, make sure that if you have questions that you put them in the comment section below. We will be getting to questions that we can ask of Barbara as well. So any questions that you have regarding any of the content that we are talking about, the more related to what we're talking about today that your question is, the more likely we will actually get to answering it. But before we get to that, let's go ahead and jump into our next sponsor here.
Yes, our next sponsor we've got is Sound Oasis. So if you have tinnitus like myself, you know that those quiet environments can definitely make it more noticeable. And one of those quiet environments that we run into nearly every single day is trying to sleep. So Sound Oasis has an entire lineup of sound generator products. They also have their BST 100, which is their tabletop sound generator speaker that has sleep sounds and Bluetooth audio in it as well. You can build your own custom sound library by taking 10 to 20 different sounds from their sound library. And the BST 100 also is able to pair via Bluetooth to your mobile phone or device so that you can use whatever type of sounds work best to help you kind of habituate to your tinnitus. Now, you can also visit the App Store. Sound Oasis has several apps, and if you just type in Sound Oasis, you will see they pop up. They've got great sound generator apps as well, so try those out. The free or the light version is free for everybody, but with any purchase of a Sound Oasis product, you do have access to the Pro version once you link the device up to your phone. So make sure you visit soundoasis.com and use promo code SLEEP. That'll get you 20% off of any of their products.
Awesome. Thank you, Sound Oasis. So, Barbara, you had mentioned a little bit when we were talking about the OTC devices about how, and you're absolutely correct on this, how some individuals can go the prescriptive hearing aid route and get prescription hearing aids and not have success. And one of the main reasons for that is because their hearing care professional is not following best practices. It is not providing person-centered care to ensure that they receive the highest level outcome with their technology. So how does HLAA educate their members about ensuring that not just that they're getting good tech, because we know we need good tech, but getting a really good hearing care professional on their side?
That's a good question. We talk a lot about patient-centered care, and we have a resource on our website, a checklist of things to ask your audiologist, things to look for. And of course, we're a great promoter of patient-centered care. There are some great materials from the IDA Institute that many of our members have participated in their groups so they can find out what people need in patient-centered care. I'm on their advisory board, and we try to communicate that to people that, you know, you really deserve quality of care. And in like anything in healthcare, if you're not satisfied with the service or treatment you're getting from your doctor, you know, we live in the era of we really take control of our healthcare. I mean, how many of us will Google our condition before we get to the doctor, and we tell the doctor what we need, right?
Yeah.
And I know the doctors just love that.
Yeah.
But we live in that era where people, they know and deserve, and they can get quality of care. So I say shop around. If you have a hearing care professional that's not meeting your needs, find another one if you can. And I think it's really great. I don't know if you do any telehealth, but people now, like you say, who live in rural areas, we know that, and you can correct me if I'm misquoting a stat, but I think the majority of audiologists are in urban areas, and there certainly aren't enough audiologists to serve all the people in the world, or hearing instrument specialists. So I think telehealth and telecare is really important, as long as you make it accessible, that there's captioning on there and people have a chance to get care that way as well.
Absolutely.
And your support groups too. I mean, I think just even allowing people to meet other individuals with hearing loss allows them to bounce not only ideas off of them, but getting recommendations. Who's your hearing healthcare provider? Are you satisfied? Are you having success with your devices and your treatment or not? And like, word of mouth is just probably one of the strongest elements there. And it's just so great to be able to share those not only hearing aid based ideas, but who's your provider? Where are you getting treatment?
Oh, and they do, believe me, because that's what we all do, right? If we have a good person who gives us a service, we recommend them. And also, I think people who are really involved in our community also ask for products by name. They ask, I don't know if you've seen this in your practice, do they come in requesting a certain brand of hearing aid?
Well, for sure.
Oh,
yeah, absolutely.
Yeah.
Yeah,
And that's
so
great. And I think that anytime someone is trying to educate themselves before coming into our clinic, I'm always a much bigger fan of that type of individual than someone who has no concept whatsoever about their own hearing health and the treatment options that are available. Now, they might come in requesting a particular product because either they heard about it from someone else or I talked about it on my channel, and they come in and I'm like, actually, that device is probably not the best device for you, and then we have to steer them in a different direction. But as long as we're justifying the reason why we do that, and as long as we're taking that person-centered, patient-centered care approach, incorporating them in that decision-making process because we're taking their wants, needs, and values into account when we're making a recommendation is extremely important.
Most definitely.
That is, or else they've heard about a product at our convention or saw an ad in our magazine. And I think, you know, we get the question all the time, and a lot of reporters will ask us, what's the best hearing aid? And you know the answer to that. The best hearing aid for me is not the best hearing aid for you, because hearing loss is so all over the map. I don't know how else to describe it if it's unique to each individual. But I guess all we can do is really talk about the features, and then you as audiologists know what the best fit will be.
Yeah, I talk about this a lot. You know, people are always searching for the greatest tech, and I love giving them that information, but I also have to make sure I'm very careful of making them understand that, like, I know that I'm saying a bunch of great stuff about this, but at the end of the day, it matters how well this device is fit and programmed for you as well, how comfortable you are with it, and the way that you hear might be different, like you said, from somebody else who's doing great with the exact same product, but you might not do great with that.
Right.
So it's very important considerations, and this is why following best practices as a hearing care professional is so important. And I'm glad that HLA discusses that with their membership base, which is fantastic. You know, I even started a group of hearing care professionals called the Hearing Up Provider Network, which is a group of hearing care professionals who are committed to following best practices. And we typically have a Hearing Up Provider Spotlight where we spotlight one of these providers across the country. We don't do that when we have an in-house guest, though, because the guest is definitely more important for this episode. You flew all the way out here, so we're going to give you the
Absolutely.
entire time. So, but thank you for sharing all of that and what's going on with HLAA. We do have time now to field questions. And
Yeah.
so you guys might notice that Kelsey is not actually in studio today. But Kelsey is at home, and she's so committed to this that she's joining us virtually today to ask us these questions. So Kelsey, hey, good to see you. I haven't seen you all day.
Hey.
I know, it's good to see you
And I
guys
can't
too.
hear you.
Thanks for
I
having
can't
me
hear
on.
you.
So
either.
hopefully,
Oh,
Chris,
fantastic.
hopefully we can get the audio back for Kelsey here.
We had it earlier. We did confirm. So hopefully we can get that back here pretty quick.
And you
Do I
know,
test
the
it now?
hearing loss community is so small and close-knit that I actually know a number of people who know you, right? And so, you know, topics come up and we start chatting and it's like, oh, I know so-and-so, I'm going to be meeting her for this or that or whatever. And the other thing that happened is that, and you had alluded to it a couple of times earlier in the show, is that I did a reaction video to one of the interviews that you had with PBS. Okay, now you said that I could bring this up if I wanted to. And so I do some reaction videos to different things that I hear, and I saw this PBS video with you being interviewed, and I'm like, I gotta watch this. And I watch it, and I should say, it was a fantastic interview. I have been in the position of being interviewed in that context, and it's very difficult to do, especially when it's all done virtually, right? And I ended up doing a reaction video reacting to several things that you said and to some of the questions that they had asked and giving my insight. And so I want you to be able to kind of say, like, you've done I don't know how many interviews, and you must be getting requests for interviews all the time.
Yes, and thank you. I say that Dr. Cliff unpacked me, and I really enjoyed it. And what I appreciated, you know, I thought it was great. And what I appreciated was you're amplifying hearing health even more. You took my video on the PBS NewsHour and, you know, amplified the topic, and I think that's the great thing. And I had a lot of fun with it, and that's, you know, truth be told, I contacted Dr. Cliff and I said, let's do a show together, and he said, well, come out here to Phoenix, and I called his bluff, and I'm here.
Yeah, there you go.
And thank you so much. And, you know, I think the main takeaways from that PBS NewsHour were there that hearing health is a major health concern and we have to take care of it. And I had just random people who I've never met calling me on the office line saying, Barbara Kelley, what can I do? I want to start a chapter. I want to get involved, you know, that information. So I think wherever we can amplify this message and spread it out, and I really appreciate what you're doing with these videos. I think it's great.
You know, I had Kelsey send me the questions that she had
Okay.
prepped and ready. And one of the questions is, why join HLAA? How often do these chapters meet up? And does it depend based on the area and how involved the members are in each chapter?
Yes, our chapters differ. Some of them are very active. They are pillars of the community. The community depends on them to be a resource. And then we have some chapters who might just be getting started, and they just meet socially. But they have that peer-to-peer support. But you can find a chapter or start a chapter if you wish. It's not hard to do. And joining HLAA, anybody can be a member of our community. There's many ways. You can get the magazine by paying a membership fee, or what I tell people to do is sign up for our free online newsletter, which is chock full of great information. You can attend a Walk for Hearing. We're in 20 cities across the country. In fact, on November 5th, we're right here at the Arizona Walk for Hearing in Mesa. And I love the Walk for Hearing because this is where we see children with hearing loss and their parents. And we really see the representation of the community, of who lives in that community, and they're fun. And yes, they are fundraisers, they're walks, but they're great awareness creating events. And what we try to do at our walks is have a hearing screening van, because you know that person with hearing loss brings their friends and their family who don't think they have a hearing loss, but they really need to have it screened. So they're fun events, and go to walkforhearing.org. Just come to one. You don't even have to register. Of course, they're not going to like what I said back at the home office, but just come to one. Show up. They're fun. There's activities for kids, and it's one of my favorite events.
And here's the thing, if you can't show up and support that way, you can actually donate. And so these donations are really something that helps this continue to go, keep this conversation going, and help to grow this organization, to help give a voice to those individuals who may be hard of hearing. So.
And a portion of those funds raised stays in the community. And the alliances who are part of it do things in the community with their funds, put on programs, sponsor scholarships. They do a variety of things. So
that's awesome.
Thank you for that plug.
That's awesome.
So I think we're going to try Kelsey one more time here. All right, Kelsey, let's see if we can hear you.
All right, moment of truth.
Okay, I can hear you. Excellent.
I think we got it. There it is.
All right, so what's our next question?
All right, so the next question is patient-centered care versus best practices. Are these two terms synonymous?
So I'm going to repeat that question. Patient-centered care versus best practices. Are these terms synonymous with one another?
Well, maybe Dr. Cliff, you could help me.
Yeah, I think that they are. I think that in order to be following best practices, you have to be following a person-centered care model in order to do so.
Mm-hmm.
Technically, they are two different things. I mean, when you start looking at including the patient in the decision-making process and all of that, that is different than performing like real ear measurements.
Right.
Okay, but if you're going to perform real ear measurements in the way that is in person-centered care, you're actually explaining to the patient what you're doing, why you're doing it, what the ramifications are if you're not hitting a certain prescriptive target or whatnot. So I don't think that you can be a good provider without doing person-centered or synonymous with that patient-centered care, or doing not real ear measurement, but best practices in totality.
And your profession has best practices that you must follow as part of your doctorate degrees and your profession, right?
Yeah, I mean, state licensure will typically dictate what you have to follow of the best practices. So if you look at state of Arizona, you don't have to perform real ear measurement to be in accordance with your licensure. And that's, I think, a problem. I think that should be mandated. You look at states like Oregon. Oregon requires that providers perform real ear measurement, for instance. And again, that is just one best practice of many best practices. Okay, so just because your provider performs real ear measurement does not mean they're following comprehensive best practice audiologic care.
Right.
But in the state of Oregon, and Dr. Scott Frink, who was on our episode a couple episodes ago, he's down here, and if you do not perform real ear measurement in the state of Oregon, and that patient comes back 4 years later and says they want a refund for their hearing aids, you have to give them a full refund for their hearing aids. So the state of Oregon gets it right, in my opinion, with some of those things. But I think that the mandate, it'd be very difficult to mandate person-centered care, but I think that it should be something that's mandated. And then to get back to the point that you had said, our professional organizations that we join and we, as a certification or whatever, they require that you do these things. And so there's a substantial membership base that is not following best practices, that is not following patient-centered care. And the organizations, and I don't like to call them out, but the organizations need to do a better job of policing who they're allowing to stay inside of their organizations, unfortunately.
Most definitely. Most definitely. I think we have one final question.
All right. So this question says, it sounds like you need an audiologist even for OTC hearing aids. If that's true, is it really going to provide better access?
That's a great question. So I'm going to repeat it again, only because Barbara does not have a headset in, so she can't hear this. It says, it sounds like you need an audiologist even for OTC hearing aids. If that's true, is it really going to provide better access? I guess I will start with the fact by saying that's not true. You don't need an audiologist for OTC hearing aids. But then that gets us into the discussion of, is it better to see one anyway, or to start that process by seeing one if you can?
I think that's a common question that people have. The idea of over-the-counter is that it's, self-diagnosis and self-fitting. So the idea is you don't need the intervention of a hearing healthcare provider. Now, should you see one anyway and maybe get a diagnosis first and then say, I'm going to go shop for an OTC? I think that's up to the person. I think it just gives people more choices, and if somebody is more comfortable finding out about their hearing loss or finding where they are and what might help them, that's an avenue, that's a choice for them. But the idea of OTC is self-fitting.
Yeah. It's most definitely, I think without an audiologist in the picture or without a hearing test, it is that idea of perceived mild to moderate hearing loss, right? You are deciding which category that you go into. We know very, very well that it's difficult to categorize what type and severity of hearing loss that you have. Even when you have it and you've had it for decades, people still will say, I didn't even know I had a hearing loss, right? And we're like, you're all the way in the moderately severe range, and it creeps up on them. So I think if you would like to have a definitive diagnosis before jumping into the OTC category, confirm you are a true mild to moderate candidate. I think that sounds like a great idea, but it's not required by any means, and I just want to make sure that it's clear for this question. It is, you do not need to see an audiologist for OTC devices.
And you can get OTC devices and go in and have them, get a test, get them adjusted. We were just talking about real ear measurement there for a moment, and you could take those devices in, see if they're even capable of meeting your prescriptive targets. And if they are, in fact, that audiologist might be able to adjust them a little bit better for you by doing so. And then you have an OTC device that you did still save money on, that you can use. And yeah, you had to spend, I don't know, couple $100, $1,000, I don't know, because it's going to depend on the clinic and the clinician and how high quality of care they're going to provide you for that. But I know that our clinic is set up to when if someone calls and they say, hey, I'm trying out this, this Jabra Enhance Plus self-fitting hearing aid, and I'm not sure if it's right for me. Well, come on in, let's do an evaluation. If we can make it work better, we'll make it work better, and then you can use that OTC hearing aid. If it's, okay, yeah, you are so far out of the capability range, like these devices are not going to work for you, would you like to discuss prescriptive options? And if the answer is no, then the answer is no, but I think it'd be worthwhile to have that discussion. If you're having enough difficulty to consider OTC, it means you're having enough difficulty that you need to make a change in your life for hearing better.
Yeah.
Right?
Yeah, definitely.
And I think part of the education also comes for the people who say, I just need a little hearing enhancement from time to time, who might find some of these products that will help them maybe at work. And I think that's good too. And self-perceived, really, people are going to have to just base that on, are they having trouble hearing on the phone? Are they turning up the volume? I tell you what, a good clue is if you have a hearing loss, is if your family and friends are telling you. Pay attention to that.
Absolutely.
Most definitely.
Yeah, that's definitely the biggest telltale sign.
Pay attention to that, family.
Yes, definitely.
Awesome. Well, Barbara, we have greatly appreciated you being on the show today. Not a dull moment, if you ask me. I think that this has been fantastic. So if you guys want to learn more about the Hearing Loss Association of America, again, go to hearingloss.org. There's a bunch of great resources on there. We already showed you some of them on the show. And as you guys know, we are here every Wednesday at 4 p.m. Arizona time. Even when the time time zones change, our time zone does not change, so make sure that you adjust your calendars accordingly, because that's coming up here in like a month or so. So pay attention to that. But you can find us on YouTube Live, Facebook Live, WTSMTV.com, so make sure that you tune in at any one of those 3 locations. And as always, guys, we'll see you next week.